7 seconds, good number. Who was it that had the mute? Come on, seriously, people. I'm assuming that's, uh-oh, there we go. Is that you? I just want to make sure we're good to go. I'm assuming that's good.
I think you're ready to go.
I didn't get the final. Okay, we got the final thumbs up. Good morning. We are going to convene the Community Health Board meeting for June 2nd. We're going to call that meeting to order. We're going to do the pledge at our regular board meeting. We're going to approve minutes of the November 5th, 2019 Community Health Board meeting.
I'll move approval.
We got a motion?
Second.
Got a motion and a second. Any further discussion on that? Otherwise, I'm going to look to Deb for a roll call vote, please.
Commissioner Brecky.
Aye.
Commissioner,
Aye.
Commissioner Beard.
Aye.
Commissioner Beer.
Aye.
Commissioner Ulrich.
Aye.
There he is. All right. Minutes are approved. We're going to
Mr.
move on to
Chairman.
item number 3.
Mr. Chairman,
Yes.
I voted aye, which I think according to Robert's rules you can do even though you weren't present at that meeting. That I think was a spring meeting and I think I was out of town,
It was November 5th, 2019.
November 5th. Well, for some reason I think it had me listed as absent, so I was somewhere. So I wonder if I should,
You were there.
yeah, I'm okay, all right, I just wanted to make it.
All right. That's good. We'll let it stand as roll call. Move to item number 3. We're going to receive a Community Health Board report from the Community Health Service Administrator, Public Health Staff, and the Scott County Medical Director. Lisa, how are you this fine morning?
I'm fine, Commissioner Beer. I hope you're okay as well.
I
everybody,
am.
and well, I'm glad you're all here.
And since this is a health board, we were just on a tour, so some of us may look, talking about myself, a little sweaty. It is not fever related. It is not
Excellent.
fever related. And I do have allergies, so here's my Kleenex. I just want to, and I have a mask someplace too, but take it away.
Excellent. I'm glad you are all well.
Well,
So, Commissioners, today we're going to do our standard Community Health Board, which meets our requirements as per our statutory requirements from the Department of Health. And on our agenda today, I'm going to talk a little bit about the Public Health Annual Report, which you all should have copies, and is also available online for those who are on the phone at on our website on the Public Health page under Reports. We're also going to talk a little bit about the statewide health improvement partnership update, and I'll have Lindsay Nelson present that, and also we'll again talk about what's happening with coronavirus. The Public Health Annual Report looks a little bit different this year. It's a little shorter, and we printed only a limited number of copies. It really just highlights the programs, a few programs and some of our successes from the 2019 year, on how we've worked to improve the health and quality of life. And we include some numbers for you as well as some fun success stories. I'm just going to review just a couple highlights. For 2019, we secured successfully 2 grants to address the community health issue that ranked number 1 in our community health assessment for alcohol, tobacco, and other drug use, both for youth and adults. Our youth grant is going to be a 5-year grant, and it is renewable for another 5 years if we do a good job. We also achieved national reaccreditation for our Healthy Family model. That's our family home visiting program for the Metro Healthy Family Alliance that we partner with the rest of the metro region, and we did achieve reaccreditation. And after many years of discussion and work, we finally implemented our PHDoc, our new electronic healthcare record system, which will help us with some efficiencies and some reporting in the future. So we're really excited about that. Some other numbers that you'll see, we completed 707 direct observation visits for TB. This really only represents 4 to 5 active TB cases. We see them daily to ensure that they are maintaining their medication regimen. We provide assistance to them, make sure they're not having any reactions. TB, as you know, is highly infectious, and the medication they have to take, some of them are on medication daily for 6 to 9 months, and we work very carefully with them to ensure that they continue to take that correctly, thus not spreading infectious TB. We conducted 1,620 home visits for 140 pregnant and parenting families. Through our mobile clinic and Dr. Wilcox, we served 103 uninsured clients and provided 348 vaccines to those who otherwise would not have access to vaccine because they are either uninsured or underinsured. And we get these vaccines free from the Department of Health. We also provided 634 families participated in our follow-along program to ensure that their child is developmentally on track and gets off to a good start and is hopefully ready for K. Child and Teen Checkup had a really busy year. They participated in approximately 1,065 events promoting child and teen checkups and immunization periodicity, continuing on and making sure that kids are participating in those well-child exams. And we also participated with Adopt a Smile and partnered with Shakopee West Middle School and enabled 44 kids to get dental services. Some of them had never seen or had any kind of dental care whatsoever. So that was a big success. Our early hearing detection and birth defects program continues to be pretty busy. We provided information to 41 families. And we also, through our Community Health Improvement Committee, engaged 70 community leaders, stakeholders, and staff in our community health improvement planning. We also have some SHIPP successes, and I'm now going to turn it over to Lindsay, and she'll talk about that.
Good morning.
Good morning. As Lisa mentioned, my name is Lindsay Nelson. I'm the Statewide Health Improvement Partnership Coordinator for Public Health. And I'm going to talk a little bit about what we did the past year, but then also a lot of it will be about how we are transitioning with COVID-19 happening. And then also kind of some of our upcoming plans for the next year. So just as a refresher, the Statewide Health Improvement Partnership, also known as SHIPP, supports community-driven solutions to expand opportunities around active living, healthy eating, and commercial tobacco-free living. This is a statewide program, so it's in all 87 counties across the state, as well as 10 tribal nations. And we focus on a bunch of different strategy areas. So in our communities, we do active living and healthy eating projects, including things like community gardens, working with our parks department around parks access, and supporting our farmers markets. We work in schools and childcare around healthy eating and physical activity initiatives, as well as tobacco and vaping. We are in work sites where we are supporting worksite wellness initiatives, including stress management, breastfeeding support, healthy eating and physical activity, and then also assist with our healthcare systems. So looking back at last year, I just wanted to highlight some data points that we collected. We had a total of 88 partners that we worked with, providing mini grants in the community. That was up, I'm trying to think, by 17 from the year before, so we had 71 back in 2018. We had close to 5,000 students who had access to healthy foods through farm to school and school gardens. This just encompasses what we did last year. We have supported other schools with school gardens, so this is just in addition to those that we've already supported and who are now sustainable. We had close to 9,000 students having new and organized opportunities around active recess. 17 businesses participated in our Scott County Worksite Wellness Collaborative. So that's a group that meets quarterly, and I facilitate that where they can network and learn about various wellness initiatives. 773 total Power of Produce youth visits and 928 senior visits. And this is at one of our farmers markets in Prior Lake called the Little Market That Could. It's a program where youth and seniors can go to the market and get $2 bundles of produce for free from various vendors, so they can try different foods. And a little over 1,000 pounds of produce were harvested at Backstretch Community Garden by the CAP agency. So this produce that was harvested goes directly towards the food shelf, as well as their WIC clients. So this is our last year currently in our current grant cycle. So starting November 2020, we will be jump starting a new cycle for SHIPP. However, with COVID-19 happening, they are shifting plans a little bit. So we were going through this huge process around planning for the next 5 years. We had various content groups meeting to talk about our strategies around healthy eating, physical activity. We also are going to be able to move into working on some mental health, well-being, and resiliency work. We also had work groups meeting to determine funding structure, training opportunities, evaluation metrics, those sorts of things. A lot of those have wrapped up, but some are on hold now, just with everything that's going on throughout our state. So instead of jump starting into that new grant cycle, the next year for 2020 to 2021 will be focused more as a transition year to wrap up projects we have going on, and then also being able to respond to COVID-19 community needs. So the rest of my time with you, I'm going to kind of talk about what we're doing as far as responding to COVID-19, because I think a lot of our work has shifted a little bit. Healthy eating, physical activity might not be on the forefront of everyone's minds right now. So we're really trying to respond the best we can through SHIPP. So as I mentioned, new work for the upcoming year will be focused on COVID local community response and recovery. The state has given us a lot of flexibility in our funding. We're able to kind of ask for things outside of the scope of our funding if things come up in our community. I have a few examples later on that I can touch on that we have gotten approval for. As well as flexibility in funding, our staff time has been very flexible. The state's allowing our staff to work on any COVID-19 related activities. That included our time that we were in the EOC. We're also doing case investigations now. So they've been very flexible and understanding during this time as far as our work. All right, so I'm going to shift into talking about how we are responding to the community related to COVID-19. And first, we were pulled into our Emergency Operations Center right away when the pandemic started. We have really great relationships in the community that we were able to build upon during this time. And I just wanted to highlight a few of our accomplishments while we were staffed in the EOC. So we were able to network and meet the needs of our local food shelves. That is one strategy that we do work on in SHIPP, that we actually hold networking meetings with all the food shelves, so we were able to assist in that capacity. We were the liaison for our schools and continue to be related to needs such as student meals. I know that we also helped with childcare centers, getting meals to them. Just with their capacity not being able to leave, we were able to work with our Scott County volunteers here and have them pick up meals from the schools to deliver to those child care centers where some new kiddos might be attending. We created a couple different resources, one including a food resources flyer that we continue to update and provide to the community whenever those change. And we just continue the support through child care, long-term care, our faith-based organizations, and other community-based partners. So even though our EOC is no longer active, we are still continuing those partnerships and making sure folks are up to date with the changes that are happening throughout our county. So this next slide is just a couple examples of resources that we've put together. The first is our food resources flyer that I talked about. We have one of our staff that are continuously reaching out to these folks to make sure that nothing has changed and everything is still up to date. And this is also on our county website and is also translated in Spanish, Somali, and Russian. And then the other resource that I have up there is a handout that I put together to make sure that people are still paying attention to their health, because I think with COVID on the forefront of everyone's minds, we still want to make sure they're managing their current health conditions that they have, giving tips on how to support them in that capacity, making sure they're still doing their best to eat healthy foods. I know a lot of folks aren't going to the grocery store as often, so trying to educate on things that might have a longer shelf life than others. And then also making sure folks are getting outside and playing responsibly. The parks are a great opportunity still to social distance and get outside, so just a few tips to share with people to make sure that they're still taking care of themselves. So now I'm going to shift into talking about some of the projects that we have worked on recently to meet the needs related to COVID in our community. The first is with our CAP agency, Food Shelf. They were seeing an increase in food rescue donations and just didn't have the space to take in the amount that they were getting donations from. So they reached out to us with the need for an additional cooler space as well as an additional freezer. This was one of those instances where we reached out to the state because it was a little hefty in our funding, but we were able to get it pushed through and approved. So the picture up there is their cooler that they purchased, and they also purchased the same size freezer to accommodate those needs. And they're tracking the increase in that food rescue donation so we can kind of see how much additional food they were able to accommodate during this time. We also assisted with purchasing of some one-time use bags and boxes, just because they were now shifting to a curbside pickup model, as well as doing mobile food delivery through their mobile food shelf. They can't use reusable bags anymore, so we were trying to meet that gap as well. And then lastly, they're also working with one of our staff to plan for a couple large produce distributions. We were approached by Second Harvest Heartland that were interested in getting one set up in Shakopee here. So in partnership with CAP and Esperanza, we'll be doing a couple of those larger produce distributions for the community as well. And in line with food distributions, we have also been supporting Esperanza the best we can in their food distribution. We also have additional funding that we received about a year and a half ago from the state through a grant called Moving Equity Data to Action. So through SHIPP, we typically can't support the actual purchase of food, but with this grant, there was some wiggle room just to meet the needs of those communities. So we were able to purchase the food for the distributions themselves for the first few distributions that they had. We also supported funding a freezer as well as a pallet jack so they could get food donations from larger grocery stores and things that were coming on larger pallets. This assisted with that increase in their demand. They were doing weekly food distributions, so we were able to support them with moving forward in that capacity. Additionally, we work with our farmers markets. One of our staff reached out to all the farmers markets across Scott County because they still are able to move forward as planned for the year. So we just wanted to make sure that everyone was feeling supported with implementing social distancing practices, as well as making sure that folks are safe when they go to the market. So 2 markets took us up on the deal to support them. One is the Savage Farmers Market, and the other is the Little Market That Could in Prior Lake. So they will be implementing social distancing practices. We'll be funding things like signage, barriers to make sure people are going in one direction, and supporting them the best we can to make sure folks are safe when they go to those markets. And then I also included a snapshot of a handout that we put together every year. It looks a little bit different this year. We added some tips on how to stay safe at farmers markets, as well as included links to all of the farmers markets websites. Some have online prepaid orders, so we want to make sure that those changes are addressed in the community and folks know time, location, and what they need to do when going to a farmer's market. And the last example I included in here is one of our school partners. So last year we supported the Shakopee West Middle School in creating their school garden. They call it their Life Lab. But of course, due to COVID-19, students are not on site this year. So they're doing things a bit different. They're still planting in their garden, but they're going to be recording videos to allow students to be involved still. They're going to have the students involved in the decision making of what's going to be planted. And then students are also encouraged to stop by the garden to see progress themselves, and they can get extra credit points for their online learning. So people are being very flexible during this time. A lot of our schools that we're working with are still moving forward as planned, but just in different ways. So I just wanted to highlight a couple other items that we are working on related to our COVID-19 response. As I mentioned, I host a Worksite Wellness Collaborative for businesses across Scott County. Those are now shifted to virtually. I actually did my first one last month and it went really well. Everyone still wanted to meet and continue moving forward, so that was great to see. As mentioned, we're assisting schools with their food meal plans and moving forward with original plans that they had in place. I think a lot of the schools are really enjoying focusing on something different. So we did put it out there that if priorities have changed and you need to work on things more related to COVID-19 at your school, that is an option. But I think most just want to continue moving forward with their healthy eating and physical activity plans with us that they already had in place. We're continuing to coordinate our backstretch community garden, which is located on Canterbury land next to the Cap Agency food shelf. We're just ensuring that gardeners are safe through hand washing and hand sanitizing, as well as educating around social distancing at the garden. And then lastly, we are creating at-home activity kits focused on health. We support our friends, family, and neighbor childcare providers, and we usually do in-person trainings, but of course that's not happening right now. So we want to make sure they're still supported in different ways, and also supporting those activity kits with our Readmobile, since they won't be able to go out and have the kids come on the vehicle this summer. And then looking forward to the next year, I'm also working with our Parks Department on ways to encourage community members to get outside. We originally had plans in place to jumpstart an initiative called Parks RX, which is working with our healthcare providers to assist with prescribing getting out in nature as a way to help with their mental health and physical health. But of course, healthcare systems right now, that's the last thing on their mind, so we're trying to shift that a little bit, but then also revisit when the time is right. We're exploring new opportunities around mental health, well-being, and resiliency. We're really excited about this with SHIPP because we haven't been able to focus on this in the past, and it's been a huge need in our community. So moving forward, we're going to look to see how we can support partners in that capacity. We're going to continue working with our Moving Equity Data to Action grant through place-based projects. We've been working with some townhome communities as well as looking to connect with some mobile home communities to see how we can bring healthy eating, physical activity opportunities to the people. So I think it's still a good time to continue those conversations with people kind of staying at home right now. And I think overall, we're just responding to community needs as they come up. I feel like this next year is going to be a lot of just kind of stepping in where we can and hopefully continuing our work around our overall vision of supporting communities around preventative health. So that's all I had. I don't know if anyone had any questions.
Awesome.
There's a lot of information.
Thank you, Mr. Chair. Yeah, I just have a comment, Lindsay. Great summary, and I especially want to call attention to, it was just really great to see how you and your department were so involved right away with COVID on helping leverage and assist those groups already in our community doing the work. I think this board's made it clear many times we're not looking to create government solutions, but we want to help those food shelves, those groups already going in our communities, and give them resources to continue to build and be sustainable. So I really think your work during this crisis is such a perfect example of that. I know I use the food resources handout that you created often with different groups and organizations to help, lead them to resources in their community, either as customers and clients or as volunteers or people who want to donate. So thank you for that. It was great to see.
Thank you.
It's awesome. Any other questions?
I just, that garden at Canterbury?
Yeah.
How big is that?
We have the potential for 80 plots. It's, I don't know the exact dimensions, but we have about 40 on one side that are all for the Cap Agency food shelf, and then 40 for community members. And I think this year we have only 6 available still, so people are still.
Pretty good.
Yeah. It's a very long but wide area, so yeah.
I was just going to comment, one of the things that we wanted to do as a board is to keep those parks open, at least the trails and the green space, because it is a great place to get out and social distance and be out in nature. You made a comment about, did you say prescription for outdoor? Can you just speak just briefly a little bit more on that? Because I love that idea.
Yeah, so it's actually a nationwide initiative where you can work with your parks departments, which we already currently are, our cities and our regional parks, to put their parks information into a database. And then we can work with healthcare providers who will have access to log into an account where if They have a patient in Shakopee who could utilize even just time outdoors, not necessarily even for physical activity. They can go on, type in the person's address and get the closest park to them and what's available. So it'll be a close partnership between the parks and healthcare systems to really kind of get it off the ground. But we're working in partnership with Carver County as well to kind of do a dual county initiative, hopefully in the
And the
future.
idea you said was to kind of aid in mental health and whatever.
Yep.
I'm just curious, like, what is it about the parks or getting out that people think that will help with mental health? And this is a positive question. I'm just
Yep.
curious
Yes.
what the group's thought is on that.
Yeah, so there's actually a provider who's done a lot of research into the effects of nature on mental health and just even being outdoors. So it's pulling from the fact that you're disconnected, not connected to your phone, not connected to really anything, and just being able to take a break. I think that's the biggest piece, I guess.
Yeah, like I said,
There's like a lot of like research base behind it, and the Parks
I'm-
RX website has a lot of great information.
Yeah.
I think too, understanding that the parks are free to use.
Oh, boy.
So kind of meeting those populations, I think there's some misunderstanding for folks too that you need to have like a park pass or something to go to the park, but you don't, so.
I'm still trying to remember that because I still
Right.
can't believe it. It's awesome. We have
Yeah.
great gems in our countywide parks, and
Mm-hmm.
there is something personally about getting out into creation where I can feel my heartbeat again. And
Yeah.
so I was just curious what the thought was on that because
Right.
that is awesome. Any other comments or questions for Lindsay?
I guess one other thing that I forgot to mention, I left one of these with you all. This is kind of highlights other stories from last year as well, since I know a lot of our focus today was on what we're doing related to COVID-19, but this is a really good snapshot of our last year through SHIPP. Perfect, well, thank you.
Thank you.
Thank you for having me back, Commissioners. We're now going to kind of focus on just a COVID-19 update. I have some numbers for you and then just some examples of what we're currently doing out in the community. So cumulatively, we do our surveillance report every day. Numbers change daily. As of this morning, we had 442 confirmed cases, so increasing rapidly. 43 of those cases have required hospitalization to get over their illness. 13 of those were put in ICU during that time. 43 of our cases are healthcare workers that live in our jurisdiction, and we have had 2 of our confirmed cases pass away.
Mr. Chair,
Yes, Commissioner.
Lisa, question.
Yes.
The 442 confirmed cases, can you define that for us again?
So those are cases that have had a test and it was positive. So these are only those that had access to tests.
So we've had 442 people that, how many people have been tested in the county?
Unfortunately, that information is not available.
It's not.
It is not. I've asked a couple of times. There are many private labs
Yeah.
that are doing the testing and not sending all of the tests to MDH. They're only sending the positive tests. So we still do not know. I do know, for some examples, as we're doing our case contact investigation, we have one person in a household and they're reporting that they're the only ones that have been tested, but their entire family has the exact same symptoms, but they haven't gotten a test. Those are not included in those numbers, only those that have actually been tested.
I would think that the number of tests and the number of positives would be useful information as we consider the infection rate and whether we're reaching what they call herd immunity, which you probably want to define that for us at some point. But anyhow, just, it was a question, honest question about
Right.
what are we actually looking at here when we talk about confirmed cases? Because I'm looking at people who show up that are really sick and only 10% of them needed to be hospitalized as being a pretty significantly unscary number, I guess. I won't say positive development, but only 1 in 10 are sick enough to actually go to the hospital out of something as intense as the Wuhan flu. It just strikes me as a number that we should pay attention to and be interested in. behind that number is how many people have actually been tested and how many are coming up as positive? And are all those positive cases actually sick, or did they just show up as positive responses? You don't have to answer that. I just want you to know that inquiring minds are thinking about those kinds of questions as we deal with this whole pandemic thing.
Right. And the number of tests, we have that number statewide, and that is also included on my surveillance report. We just can't break that down by Scott
Right,
County.
Scott County, okay, thanks.
So that report that we get, that does, so those private labs that you mentioned, so MDH is, Department of Health is getting that number from them statewide?
Correct.
Okay, so, because that's just helpful to know what the data, because I think that's part of the issue for some of us and the community is, like, just what's the raw data?
Yeah.
What's
So we
the
can do
end?
our own, and then also I just wanted to, I'm gonna assume, just for folks that might be watching, the 43 total hospitalized does not necessarily correlate to the 43 healthcare workers. It just happens to be, and that 43 total hospitalized is since the flag went up on this virus. It's not
Correct.
like today.
Correct.
Do you know roughly, because I know sometimes it's in that situation report, like what the daily, how many people are in a hospital, how many people are in ICU?
We stopped reporting that because they're no longer doing daily contact investigation or daily calls. So it's difficult to get accurate data on that. Last time I checked, there was about 8, but
Yeah.
it's difficult because they're not calling us when they get discharged, and it's
yeah.
difficult to follow up. These are also not just in Scott County hospitals. These are Scott County residents that have been hospitalized in any hospital
okay.
for this. So just to clarify that.
Yeah, and that's just, I'm not trying to get to anything other than just to, because I know we were reporting that, and sometimes that situation report changes on what we're reporting, just because our data set changes.
Correct.
So it's not, we're trying to be as transparent as, here's the data, make your decisions. Sometimes it's clear and sometimes it's not because of what we get and what we have to give.
That
So,
is correct.
okay, thank you.
Thank you. This is a cumulative total confirmed cases. So right now, you can see we're at 442. And you can also see the dramatic rise in cases that we've had. Part of that is because we've also expanded the availability of testing. I also have, this is number of confirmed cases per day since, this is from the beginning, from March through May. You can see,
Lisa?
Oh, yeah,
yes,
I
Commissioner
just on
Wolf.
that last graph that, if you back that up one, what do you think that graph would look like if we would have had testing from day one?
Difficult to say, although I do have some,
Do you think it would have been just right up, straight along there like it what is now the number?
I don't think so. I think that what we're seeing here, and I do have some data coming up, what we're seeing here, Commissioner Wolf, is that we've gone from transmission just being a few cases from travel to community-wide transmission. So I think that those isolated cases at the beginning, it wasn't community-wide at that time. So
It came from another state or country?
yeah,
Okay.
that's my best guess on that one.
Well, and I was gonna have a question on that too, because everyone looks and analyzes this differently. And some people could look at that and, whoa, it's really taken off, and maybe it has, maybe it hasn't, I don't know. I'm as a family, we're trying to be wise and smart and wash our hands and use the goo and got a mask, we use it to, get in and out of the building to, support my colleagues here. But everyone handles that differently, and so that's why it's always good to have context. I know we don't always have that to help people that look at this graph and, oh my goodness, it wasn't here and now it's here. Just to help people, and I know that's all stuff but the more context we could get to help get people through this and help us to make good decisions, and I know you're trying to do that, so I'm not saying that you are not. I know it's hard for you to get some of the data from the state. I'm laughing, but it's not funny. But it's what we have to work with, so thanks for clarifying that.
Thank you. So here is number of confirmed cases per day. As you can see, it really follows the exact same graph that we just had, but these are the actual numbers. An interesting trend, you'll see in the more recent days, we had a dramatic decline in cases where we only had 6 per day. Unfortunately, that was because the state lab had to shut down, MDH shut down, and the State Emergency Operations Center shut down because of the riots, and it was unsafe for them to go. So no tests were processed those days, and with nobody in the office, they could not get any testing in, and were unable to report those. I'm told now that they're all caught up as of yesterday, though they still had about 600 tests from outside labs to process. So it really is unfortunately an artificial decline. I was pretty excited at first that, oh, maybe now we're going on a decline, but that's it started to jump up right away after that.
Well,
They're still catching up.
Just as an aside, my church friends might look at this graph and have another idea, but
Yes, I noticed that too. So here's the, Commissioners, here's the slide I was talking about for exposure, and it's very interesting how this has changed over time. When we first got cases in the state, we saw most of the cases were travel related, at first from international travel, and then state-to-state travel, and now you see that our travel cases, out of the 442, only 3% of those cases are related to travel. And we also see that community, known contact, I've got that broken out, known contact 30%. That is also dramatically increasing, and that's when you know the person you're being in contact with, or you know exactly where you probably picked it up, and we ask these questions when we're doing case investigation. We also have no known contact. That's at 23.5% almost, and that's, I have no idea where I picked this up. I don't know anybody at work. I don't know anybody in my family that has this, and we really can't trace that. Right now we're seeing that decreasing and the known contact increasing. We've been getting a lot of calls, unfortunately, lately from people who want to go and get tested because, unfortunately, they were at a gathering of some sort, and now they've received a call from their friend from the graduation party that they attended, that they are positive, and now 15, 20 kids and their families need to be tested. This also speaks, Commissioner Beard, to your question. We are seeing people who are getting tested that are asymptomatic because they've been exposed, and they are coming out positive. Whether or not they get symptomatic, we don't know at that time. We know on the day of, when we do the contact investigation, whether or not they're symptomatic. We ask them about that. But the unfortunate part of that too is that they're able to spread coronavirus to others, even though if they're asymptomatic. So we're working closely on looking at this and following this. Congregate settings, unfortunately, has also increased. We're at 12% in congregate settings.
and what are we at facility-wise as of today, do you know? Or is that-
We are at 2 facilities that are being reported, and that's those facilities that have 10 or more people that we can report on. But we have about three settings, long-term care settings that have cases. And we also have some smaller group homes
Right.
that have cases as
And
well.
so those are the ones that wouldn't necessarily show up on that report, the
Correct.
independent group homes that are,
Correct, Commissioner Beer. The number of group homes on the MDH list
Right.
only do those that are 10 or more.
Okay.
But in the 11.8%, those are individuals in Scott County in a congregate setting that also
Regardless.
includes jail, a homeless shelter, long-term care, mental health, substance use treatment. Those are all considered congregate settings.
Yeah.
Mr. Chair, Lisa, I think that's important because I've had some questions on it, how the Minnesota Department of Health site only has 2 of our long-term care facilities on it, and to remind people that it is if they have 10 or more, because people who have family members in some of our other local congregate care settings and nursing home facilities know that, they've been told there's cases there by the facility, and so they don't understand why they're not on the list. So to remember that we do have a bunch of
Right.
assisted living and nursing homes that are not on the list because it's 7, 8, even 9 cases, not 10 or more.
but that, again, I just need to clarify, that group is in this, considered in that pie, the smaller
Correct.
independent or whatever you want to call them, okay. And we have done the fit testing, I know you and I have discussed that, I mean, we've supplied some PPE to some of these sites and fit
Correct.
testing, and do our part, but the state, where are we at with the strike force? I know that's,
That's it.
Okay,
Mr.
nice,
Beer, that's a slide coming
nice.
up.
awesome.
Okay, we'll get to that momentarily. I
I'm
do
gonna-
have some interesting data for you as well. Here are the map of our cases by zip code. So as you can see, we have a lot of cases in the higher population areas. Again, by zip code, not by city. The darker the blue, the more cases. We have some areas that are combined zip code wise in order to make sure we have at least 5 or more cases where we're reporting those to protect anonymity. And then we also, on the next slide, we have, this is cases per 10,000 population, which levels it out a little bit better. You can see.
Thank you.
Yes.
This slide actually means something to us.
This slide is for you, Commissioner
Thank you.
Beard.
It's your fault.
And the population estimates is based on zip code population, estimated zip code populations. And so this is cases per 10,000 population. We are also seeing another interesting trend as far as the age of our cases. We had for the first probably at least 100 cases, no kids. And we now are seeing almost 6% of our cases are 0 to 17. A lot of those, and quite a few of those, in the 0, like the younger kids. And what we're seeing is also a jump in the 18 to 34. So what that is a result of is we're seeing young families where the entire family is sick. We have babies as young as 0.7 up to, and their parents, the entire family is not well and has tested positive for COVID.
We got a
So,
couple
Mr.
questions.
Chair, Lisa, so how many of those need hospitalization or extra care?
I don't have that data handy, but I could let you know
And again,
of the children.
Mr. Chair, Lisa, we were talking about cases. Are these people who are being tested and turn up positive?
Correct.
Or people who are really sick?
These are,
Everybody. Or
these
just
are confirmed cases only.
positive? Okay, thank you. We need to clarify that.
And again, we are seeing that in some families, only one person is getting tested, but the entire family is sick.
Sure.
And they've just assumed presumptive positive. Those are not included in these numbers, but they haven't gone to get testing. They may end up being hospitalized, but they have not gone to get testing for whatever reason. But again, positive confirmed cases only. So it's just a very interesting trend that and that is part of the original one, that we're seeing much more community transmission, known contact.
Good, okay.
This is just race and ethnicity of the cases that we're seeing. We have about 38% of our cases are white, followed by race unknown. And some of those race unknown, that changes all the time. In some of those, we just haven't had an opportunity or haven't been able to reach the individual to do our case investigation to identify those. So that does change daily as we do our case investigation. Non-Hispanic is at about 55%, and Hispanic is just under 30%.
Lisa, Mr. Chair, you don't have the gender split on this one. We get it on our daily report.
Correct.
I want to point out that there's an unfair gender unbalance, that whole thing.
Commissioner Beard, I thought it was pretty close to 50-50, representative of the population, but again, that also changes every day.
It does, yes. I'm sorry, I'm being facetious. Ms.
That's
Lisa,
okay.
You know that, but
It might be interesting to take a look at, and we could also provide this data of those that are hospitalized.
yeah.
The male and female breakdown on that. That might be interesting to take a look at, and we can
If
certainly
you
provide
ever
that data
provide
for you.
provide age as well, would you?
Certainly.
Thank you.
Before I forget, I'm of that age that I know, unless I write it down.
No,
You're in your 30s.
Thank you. So just a little bit, Commissioners, about what we've been doing. We have taken on case investigation and contract tracing until the state is ready to open up and do their center approach that they have proposed. As of last week, we have 24 staff, students, and volunteers trained. We have agreement with St. Kate's. We have 3 students from St. Kate's, 2 that speak Somali, and one that speaks Spanish. And we also have partnered with River Valley Health Center, and they have provided their Spanish-speaking nurse to continue to work with us for the next several weeks at their cost. They're paying her salary, so that's not at a cost to us at all. And we have trained numerous volunteers from our Medical Reserve Corps, and we'll utilize both the students and the volunteers as often as possible, so our staff are not incurring overtime as well as they're focusing on their regular duties, which haven't gone away. But we have 24 staff, students, and volunteers on various teams. Case investigation is done, just as a reminder, Monday through Sunday from 8 a.m. to 8 p.m. or until we're basically done with the cases. We started off about 60 cases behind because MDH got overwhelmed. I am very pleased to say that we are completely caught up. We get to the cases within a day. And we were so caught up as of last week, I called MDH and said, if you need to send some of your cases over to us, let us know, because we have volunteers poised and ready to work. And let's get these done. We know the faster we get to them, the less likely that they are to go out and transmit the disease. So working very hard on that. We have been in connection, contacting our long-term care providers, and Commissioner Beer, this gets to your question earlier. We have completed fit testing in a couple of different locations. According to the state, they're required to wear N95s if they have positive cases, which they haven't done before, so they did not have the capacity or the training to conduct fit testing. And we were able to go out, and we originally proposed a train-the-trainer model. That didn't work for a couple of them, so we actually fit tested many of their staff. One problem was we started to run out of the solution that we needed, and it is completely unavailable. And St. Francis stepped up and compounded the solution for us at no charge to us. So really good partnerships there. We've been reaching out to all of the long-term care providers to connect them with resources, particularly provide some information to them on how they can sign up for testing if they wanted to, and sent them the link. This is a whole process that MDH has developed. This is fit testing with the National Guard. As of today, 4 of our long-term care providers have signed up, and some of them are calendared already. This includes McKenna Crossing. They have signed up. We did actually have the National Guard here last night doing some testing. At St. Gert's did some testing. So just as a note, if you see the National Guard these days, it's a little concerning. If you see the National Guard in our community, it's more likely that they're doing testing versus any kind of control of demonstrations or riots. So they are around.
On that point, I would just say that I know we're trying to be a little more hip to the social media, that we maybe want to, maybe it is, and maybe I missed it because I'm not that hip to social media, but just to let people know, because people are on edge.
A little bit high
a lot
alert
of
these days,
reasons.
correct. Thank you, Commissioner Beer.
Thank you.
I'll make a note of that as well. And we have provided PPE for several of them. I've had some really good positive feedback from several of our jurisdictions when they call me. Scott Haas has been fantastic in getting there within just a couple hours to provide that PPE. So they have been incredibly appreciative of the resources that we've been able to provide them with. The other thing that some of our staff are working on is we're reaching out to the employers that have positive cases. We do have a couple entities in our county that have some significant high numbers, and that we have been working collaboratively with them, as well as Minnesota Department of Health, to discuss plans that they have in place, how they're reaching out, infection control, any way that we can partner with them to try and curb that. Just really talking about case precautions, et cetera. Some of the employers, particularly Amazon, has a fairly robust plan, and they have also, in our call, have developed some really good materials on how to put your mask on, et cetera, that they're willing to share with other employers in the county, and have really stepped up. They also have identified community leaders that work at Amazon for various different cultures to be able to help provide those messages to their community. So they've been very at the forefront of that.
That takes one of my questions away, because I figured they would be. So we have a collaborative relationship and between us and them and?
We do.
Good.
We do.
That's
So it's been very positive. And we have other employees, we have another call with another employer coming up in the next couple of days, really just to discuss the surge that we are seeing with their employees. Lindsay also talked about updating our food resources, and we are also currently, and I'll let Dr. Wilcox talk a little bit about this too, but we're currently putting together a plan and proposal to send to the Minnesota Department of Health to put together a strike team, so to speak, for some testing. And that is in response to Minnesota Department of Health saying we are overwhelmed, we need help getting tests out in the community, can you help us?
Mr. Chair, any particular target or
Yes.
game plan for who you're going to test or?
Yes, we are going to focus on those where we see a lot of cases, for example. I do see trends in the data that I look at, multiple cases in various apartment buildings that we might want to get to. And in addition, while we're there, we can also be providing some education on prevention. They are looking at, for example, at-risk populations, including migrant workers that might not have insurance. So we will be sending out information to places such as, like the Canterbury. Canterbury has a lot of migrant workers in their dorms. That would be a population that we might want to focus on. Apple pickers that are coming in, seasonal workers, meat plants, just really those high-risk populations, possibly trailer parks, places where people might not have access to testing, and this will help us get a true picture. The other piece we're going to look at as well is the long-term care facilities. We are working with them if they want testing and want to do it themselves versus the National Guard. We are working with them to help them get resources from the Department of Health to be able to do that testing themselves. And if they can't do it and don't want the National Guard or don't want to wait for the National Guard, that would also be on our list. The thing is with the long-term care, it's not just a one and done, because we would have to probably do a plan maybe to go every 2 weeks or every week just to get it tested regularly, particularly with their staff.
Is there anyone anywhere, and the reason I'm asking this is, it seems when we go to hotspots, we're gonna get data that's skewed. Like, we might have some infectious, close proximity, like at the racetrack, for instance. But somewhere in the United States of America, somebody has to be doing some blind research type testing to see just what the infection rate is in the general population, to kind of understand the severity or did we overstate the case? Is it understated? Is the infection rate dropping? Is it rising? Symptoms, because I've read reports in healthy young male populations, mostly prisons, for instance, high rates of positive tests, very, very low cases of people actually being sick. It's like they've developed an immunity or something, I don't know. Help me know how to ask the question. That's why I'm asking these kind of questions, because it seems like what we're doing is kind of skewed towards making things bigger and look more intense than they may actually be. Where is the credible evidence, or who's doing the credible research that can create a true picture across the spectrum of ages and genders and things like that that help us understand just exactly what we're dealing with here?
Commissioner Beard, that's a good question. I think part of those hotspots and going to at-risk populations is to ensure that the field is leveled, so those that don't have access to testing will get access, so we can get a full picture. The reason why and I think when all is said and done, when this is over, we'll have really large numbers and we can do a lot of studies there to figure out what is the true picture, what does it really look like. Right now, we're just trying to figure out who is positive so they can stay home, so they can isolate, so they don't spread it to others versus the data. It really is, even though those people in jail in a congregate setting might not be symptomatic, and part of that reason is because they're young and healthy, we don't want them going home after they get released and going to visit their mother in the long-term care facility, or,
See, that's part of the data I think we're missing, because I think there's an assumption being made, and the data hasn't actually been proven. Now, you don't have to get down that trail right now. Just know that there are inquiring minds that think about these kinds of things. I don't know, maybe I shouldn't have started this row with you anyhow, but somewhere, somehow, there's got to be true baseline testing that actually tracks infection rates and how things are spread. I see CDC issuing conflicting advice for the last 4 months. Masks are good, masks aren't good. It spreads by surface contact, well, maybe not so much. You know, things like this.
Right.
As we learn, the assertion is made, then we learn and we change the assertion. So the whole
Correct.
business of we got to take healthy people and lock them down because they might infect my grandmother, I want to know that that's actually the case, and I get this queasy feeling that we're still grabbing at straws here and making assumptions just because somebody's immune system might be weaker or they might be in frail health. Just know we think about these things, and if there's ways you can help convey that information to this board and to others, I think that would be a great public service. Thanks for letting me just ask those questions and make those points.
No, I appreciate that, Commissioner Beard.
Well, I would just say that if you weren't gonna ask him, somebody else was. Because I think what drives us all nuts is, it is squishy. Everyone's learning new things, this is good, this is bad, don't do this, okay, now you can do this. I was hoping that the Frito-Lay bags for walking tacos at all these grad parties were okay, that we could, but anyway. So I think part of it is,
should
it's
never
just,
eat one
it
of those.
changes. All of this is changing.
It's a moving
It
target.
is.
Which really then makes it hard, at least for me, like, okay, where is the truth? Where's truth? Not that there's, I'm not trying to insinuate that there's, but it just makes it harder to find that baseline, like, what is truth? And we are learning new things, so we haven't quite stumbled on it yet. And it does appear like, as Commissioner Beard mentioned, not that we are grabbing at straws, but this is just new and changing, and everybody wants the information to make actionable decisions on. So it is a little nutty. So with that, can I still go on to my strike force? Because is there another, I'm looking ahead,
I only have a couple slides, so
I
don't think-
I
if
saw
you-
strike team, what makes
yeah.
me come out of my skin on that is, 3 weeks ago, we heard the governor talk about a strike force for these long-term care. That's sort of, and I'm looking at the good doctor, that's sort of the known commodity of this. I even hate to say that long-term care, that's where the death is happening. Like, there's not a whole lot of wondering about that. That's happening. And as a county, yeah, we're going there with the PPE. We're going, I'm looking at the good captain back there through the window with his mask on. Look at that, giving a thumbs up, supplying the PPE, and you guys are doing the fit testing and all of those good things. But that seems to be the area that we kind of know, and I'm going to use air quotes there. Like, where's this strike force that we talked about? I mean, that's where people are dying. And so in the county, we have 2 deaths. Okay, maybe it's not that big of a deal if flu kills more. Look, I believe in eternity. I believe in heaven. I believe in hell. To me, that's 2 souls that are sealed. I don't know their fate. It's a big deal. 1 death is a big deal to me, so I'm not minimizing that. But what can we do? What pressure do we need to apply? Like, this is a known thing. Why are we not getting on this? And the we is all of us, not just the county,
Right.
we have very limited resources. I know the state is burning through things. The feds are that's the known commodity.
And Commissioner Beard, thanks for your question. There are several strike teams that the state has put together. They are doing testing in addition to the National Guard. So we are getting out there. In one question, or one thing that you mentioned, that also has changed, as looking at the deaths in the county, or in the state, it has changed. We started off with about 95-97% of those that have passed away from COVID as being the seniors. We're now down to 82%. So the age is dropping as far as the deaths. So the sooner we can get people tested, the sooner we can, get them isolated, the sooner that they can go seek medical attention if they have this. And that's also the purpose of the strike teams. So they are out there, they are being done, and we are trying to get as many people tested as possible, starting with the long-term care, because that is where we're seeing 82, I think the last number I looked at was about 81% of the deaths are connected to long-term care facilities, but that has been dropping. So, and is that, that could also be because we now have more cases in the community, that community transmission. So every time, the data changes daily. We
Oh, I
learn
know.
stuff every
I know it
day.
does.
It's very frustrating, and I usually caveat my answers with, here's what I know today, because that really
Oh.
could change tomorrow.
Or by the afternoon. I mean, I totally get that, and I get it's almost impossible or potentially impossible to truly isolate those groups because you got coming and going. They need care. I mean, I get that. It's just partly maddening, to be honest.
It has been, and my nurses, I have to sing their praise, have been very, very flexible. They are very used to, here's what you do, first, second, third, fourth. They're very used to things not changing, here's what we do, and things are changing so much, and it causes a little bit of stress. But
For
they
sure.
have been
Yes,
fantastic
absolutely.
during this, and unfortunately, it's gonna carry on for many, many more months.
Right.
So. If there's no other questions on that, I'm going to talk a little bit
All right,
about
I'm
food.
gonna sit back in my seat. We got
thank you.
through that part.
Just a little bit of the food access issue. I know Lindsay touched on it a little bit, but overall, food shelves have seen an increase in the amount of food that is being distributed compared to our last year's. Although the number of households they are serving have been pretty comparable, so that's interesting to look at that too. There has been huge increases in demand, particularly Esperanza has had about a 400% increase in their food resource giveaway needs. CAP has seen a 62% increase, while others are remaining steady. And part of that could also be because of their location, where we're seeing more of the cases, higher populations. Just to note, the school food programs are stopping services on the dates that are listed down here, so that could, although some are continuing, some summer programs, some are not. So that could lead to an increase in demand on our community food shelf networks. So we're watching that carefully also. Given that we're in Scott County, daily I get questions on how we can help. That's what I love about this community. Belle Plaine Food Shelf did let us know as we reached out to them, they would love some volunteers, and here's the contact information for Anna Lee. Esperanza Food Shelf also needs volunteers, and there is a sign up on the website at this link here where people can sign up to volunteer. And all the food shelves in Scott County are looking for donations, personal care items and others. And they also said that a good reminder is they can purchase food bulk, so they get a better price than food. So donations of cash are also very helpful. So if you've already donated, thank you. And for those that are interested, that will also help.
And I'm just gonna say, that's probably worth repeating, because I think, I'm looking at Scott again, thinking about the tornadoes we had down in St. Pete and all the bad bananas. I mean, that was the example he used. That sometimes writing a check is a good thing. I think sometimes people feel like they need to, I know my bride's out shopping for stuff right now, and but sometimes, does anyone write checks anymore? But you get the point, cash.
I think so.
Yeah, exactly. What's a check?
Depends on what
So
they
that
are.
if that's a good point. If they can get that food cheaper,
Right.
that money goes a lot longer than. That's a good point.
Yeah. And we offered in the Esperanza food distribution, most of the meat that they were getting at a discount was pork, and the Somali community
yeah.
doesn't eat pork, so we offered to purchase chicken for them, and they said, just give us the amount of dollars and we'll purchase it on behalf. I was shocked at how much chicken they were able to purchase. We didn't give them very much, and it lasted, I think, 3 of the food giveaways, so it was amazing. So
That's
yeah,
saying
those.
a lot. That's saying a lot, because.
And Cub Foods also, I want to give a shout out to Cub Foods, what a good partner they've been with Esperanza to be able to provide those bulk discounts for them. So again, it's just wonderful
is, it
examples
is.
of how our community is stepping up and helping each other. And one last one is, that should say essential supplies. The YMCA is also doing a giveaway. It's take what you need, leave what you can, and they've said some specific things that they're looking for, particularly diapers and wipes and feminine hygiene products are in big need. Paper towels, toilet paper, still a need, although last 2 times I was at Cub Foods, they had, if you get there early in the morning, they have quite a bit. So face masks, so they've actually listed some specific things that they are looking to do, and they are also still doing their food drive, which is continually giving away all their food in the day. So again,
Have you seen masks hit the supply chain? I have not. I mean, just for Joe Blow out at
we
Lowe's
have
or Home Depot,
ordered,
or, not the fancy, but just something?
yeah.
Have you? Okay.
Oh, yeah, I've seen those
Okay.
ones that you can buy, like a five pack, the disposable kind.
Yep.
Those have been, at the gas stations, they seem to have them.
Okay, good.
N95s, we haven't been able to purchase or haven't been able to find, and other, hand like this is gold. These fly off the shelves. Daycares are in big need of these as well, to be able to try and keep, their areas clean, and they're difficult to get.
Yes, they are.
So is there any other further questions before I turn it over to Dr. Wilcox?
No, we peppered you. Thank you for.
Excellent. Thank you. And I made a note of those items that you have requested. Hopefully I didn't miss any, and I will send those out.
Thank you very much.
Thank you.
The good doctor, good to have you.
Thank you, Commissioners. Let me say it's great to be back. Really appreciate the ongoing opportunity to touch base with you folks, and it's been great, of course, to work with this great staff. I continue to really appreciate that. I really have no PowerPoint pieces in place, but I thought it would be reasonable at this point to maybe be available for you for a Q&A thing if you have issues of that type. But I'd also like to address some of the questions, Commissioner, you brought up about testing.
Sure.
I really do believe that we were a bit behind the 8 ball in having tests available to do community-based testing. If you look at what was done overseas, for example, in Korea and in China, they were able to do a terrifically large number of tests in a very short period of time for their entire population, which gave them a unique opportunity to get a feel what is really the intensity of illness that this virus is bringing to us. And we were a bit behind the 8 ball in our country because initially the only tests that were felt to be appropriate were those that the CDC was going to provide for us, and it turned out that they were not good tests. So we ended up getting behind the 8 ball right from the get-go. And that's kind of why we're in a situation right now where we're trying to find additional ways to get testing done and so on. And I think in the future we will have more data demographically that'll help us to decide that. As we look at this virus, the coronavirus, the COVID-19 virus, is a novel virus. There was a question brought up, sometimes they're telling us to do this with the virus, sometimes they're telling us to do other things. This virus is novel to the human race. And we're kind of learning as we go on with managing this thing that it's affecting us differently and at different ages, at different points in the development of the illness. Now, you may recall Lisa had, I think, a really fine graphic indicating what age groups in particular are showing positive for testing results. And if you see a good number of those folks that are getting positive results now are younger people. They're in their teens, they're in their 20s, their 30s, 40s, and 50s. Now, it appears that a large number of these folks, when exposed to this virus, may present with minimal symptoms or be asymptomatic for extended periods. That was brought up. The problem is they're highly infectious. So especially within 2 to 3 days of the time that you pick up this virus, they are spreading the virus all over the place and they don't know it. And that can be problematic because if you end up then exposing someone that is elderly or has comorbidities, hypertension, heart disease, COPD, diabetes, see that a lot, of course, in our elderly, they end up with significant insult from this, and that is a problem. But what we're finding now also, we were thinking initially, well, our pediatric patients really aren't showing much problem with this. And now because this is a novel virus, what we're finding is even those younger people now, as they develop problems down the line, 2 to 3 weeks down the line from exposure, they're getting sick. They're developing this syndrome, the pediatric systemic inflammatory syndrome. You've seen this. They develop rashes. They end up with respiratory difficulties. It can affect heart function. These kids can go into liver failure and renal failure with this. And this is a manifestation that we were unaware of before the process has evolved. It was brought up, fortunately, that the elderly, when they do develop this illness, if they end up in an intensive care unit and they need to be assisted with ventilation, airway management, initially the full court press was you put them on a ventilator. You intubate them and you put them on a ventilator. Well, what we've been finding is if they're on that thing too long, they end up with significant barrel trauma and you never get them off. And they end up then dying as a result of this. And with ongoing research now, we have been finding that if you don't put them on the ventilator right away, if you put them on other airway management devices, like a BiPAP or a CPAP unit with oxygen supplementation, they do better. And I've talked to some of the internists that I work with at Hennepin County Medical Center. They have had excellent, really, outcomes for some of the people that they have in their unit there, elderly and so on. 70% of the people that they end up putting on ventilators, they've gotten off successfully. Now that is terrific data that shows they're doing some really good things research-wise in handling this problem. But that comes with time as you deal with this virus. Yes.
70% on ventilators, you mean the CPAP, are you including that in the number of what you would call ventilators?
No.
Or the actual intubation?
Actually, intubation. What they're finding is they try very hard not to put them on ventilators.
Yeah.
They'll initially put them on CPAP, BiPAP units, and then if they need to be on ventilators, they have successfully cut way back on the amount of pressure it takes to get oxygen into their systems, so they successfully get them off. And that is terrific. But that comes with research and dealing with this unique virus.
Early in the pandemic, the idea was we don't have enough ventilators, everybody needs a ventilator, and it turned out that the initial application of ventilators was almost like a death sentence.
That's correct.
And so now we've learned.
We've learned from that initial issue
Yeah.
and dealing with it, that that's not really the pathway to follow for some of these
good.
people.
Thank you.
You know what I'm saying?
Yeah.
So, you know, you mentioned it's kind of a moving target sometimes about how we handle this virus and so on. I agree with you, it is, because it's a novel virus, and we're doing ongoing research to determine best practices that allow us to handle it appropriately. Now, the last thing I want to leave you with is this. The last week in our metro area, we've had significant unrest related to issues, problematic issues, and there's no question about that. We've had demonstrations and so on. If you look at the grouping of people that have been in that metro area for extended periods of time, typically young, not socially distant, not wearing masks, some of them, and probably hygiene-wise, not scrubbing their hands a lot and using antiseptic products. They've come in from outside of our state, some of them, and some of them are now heading back to where they're coming from. My concern is 2 to 3 weeks down the line from what we've been dealing with now this last week, what kind of impact is this going to make on the surge in handling this virus within our state? And if we do some point of contact follow-up, when these folks that were here and have gone back to their states or whatever, what kind of impact will this type of interaction present to them and the people back in their states? You see? I think ongoing research is going to show that. My hope is that the surge will not so overly hit our healthcare organizations that they can handle it appropriately. That's my concern. Now, I'll certainly open it up for questions at this point. If I can answer those, I'd be
Thank
happy
you.
to.
Any follow-up questions?
Do you want me to just talk a little bit about the strike force thing?
I'll come back out of my seat.
Why don't I leave you?
Yes.
Okay, you know, Lisa and I have really been very, very cognizant of what we can do to impact follow-up care for folks who have COVID-19 in parts of our community where access to health care is a problem. And our thinking would be, well, why don't we then develop a grouping of teams, perhaps an EMS provider in partnership with a community health worker, for example, and in partnership with public health, and having these folks, if necessary, go into the community where these folks are and do the follow-up testing and so on that's reasonable and appropriate for them. And so we're developing further that model. We're looking at community paramedics who are trained to do this, and community EMTs who are also available to do some of this initial work. And pretty exciting, because I think we can really show some terrific outcomes if necessary for that group of folks in our communities who have a tough access to healthcare issue. So I look forward to working with Lisa on that.
I've got two questions
Yes, Commissioner.
with the Rona, as I like to call it. Mutations, like
Yep.
the first couple weeks of its revealing itself here, and maybe it was here early, but anyway, March timeframe, there was talk about a mutation then, and I have not heard much since. Has it morphed, mutated? What have you seen in your expert opinion?
You know, it does not appear that it is mutating or changing its RNA configuration significantly. Okay, so from that point of view, hopefully it should make it a bit easier to develop a vaccine in a shorter period of time to deal with this. It's kind of like what you see with every year, you know, the influenza virus kind
Right.
of changes its genetics, and that's why the vaccines you get sometimes don't help you much. But it looks like this virus doesn't change its genetics very much yet at all, which is good.
That's good. And the other question was antibody testing.
Yeah.
Where are we at with that, and are they legit? Are they getting there? What does
That's
it
a great-
mean?
Yeah, that's a great question, Commissioner Bear. The antibody testing is going to be important if you can rely on it,
Right.
if it gives you the right information, okay? Up to date, some of the antibiotic testing that is being marketed is not reliable.
Right.
And there are some tests on the market that are 50-50. Well, that's not helpful.
No.
I mean, 50-50 yes or no is not helpful.
No.
The tests that really are going to be helpful are the ones, what we call the serology tests that you actually can use to determine the amount of antibody in the bloodstream that is appropriate to fight off this infection. And those are the ones then that are being used. Those are the tests that are being done, say, in the Mayo system, where they're actually getting convalescent serum that they can harvest and present this to really sick COVID-19 patients with this antibody-rich plasma that they harvest from individuals who've gone through the illness and have on the other side of that tunnel. Those are the tests that are going to be useful, but it takes a bit longer to get that testing done. It doesn't give you an immediate result, and it is a more expendy test than the other tests that they have on the market, where you do a finger stick, you put it into a little module, and it gives you a result within 15 to 20 minutes. Those tests are not reliable at this point.
Right.
Related to that, maybe you can help clear up some confusion, Doctor, about this business of the plasma and the antibodies. Who has them, who doesn't?
Yeah.
So if I would get a test before a procedure I'm going to have next week, and it says, oh, you're positive, I could say, okay, I'm positive, but I've never been sick with this.
Yeah.
Would I have the antibodies, or do I just test positive? Or would I actually have to be really sick and fight it off and back to health, and now I have the antibody? Can you help us understand what that means?
You know, each of our immune systems tend to react to this virus in a different way.
Okay.
You know, some people get through the infection and they aren't really symptomatic, but they have a terrific antibody reserve that's built up. Other folks just don't get through it very well at all. They get really sick from it. They come out on the other end and their antibody levels are pretty darn low.
Oh.
You know, so it kind of varies from one patient to another. And that's why if you're thinking, I want to give my plasma, for example, because I think I've had the virus and so on, they do the serology test that gives you an exact concentration of antibody that you have in your plasma. And that's reliable. And they will harvest your plasma then and have that available for folks who are really sick. It gives them a passive immunity is what it does. It gives them a short-term boost in their immunity system that's useful for them to get through the initial insult. But that's a more sophisticated test, and it takes longer to get the results back. And they will only use that test most often for folks who may want to give their plasma and give this convalescent serum.
So just because somebody has been sick and recovered doesn't mean that they're going to have quality antibodies they can donate or plasma that actually can make a difference for someone else.
That is correct, Commissioner.
Perhaps, but not necessarily.
Right, you know, this COVID-19 virus has characteristics that are somewhat similar to the virus that causes the head cold for us, you know, every year.
Sure.
And so you can end up with some of these non-specific tests that are not reliable for antibody studies. And you'll end up showing a positive test, but that's because you had a head cold a year ago. See what I'm saying? Doesn't mean that you had COVID-19, as an example.
Okay,
Yeah,
thank you.
sure.
I think we could probably continue for, because it's, we're all trying to learn and, I guess, okay, one last question maybe. People that have had it
Yeah,
and that have overcome it,
yeah.
are they immune?
That's a great question, Commissioner. It keeps coming
Now
up.
we fade to black from here, just let it say it.
Well, here's the deal. I mean, you would expect, if you look at what happens with other viral exposure, that you will end up with an immunity that will last for you for some period of time. You know, it depends on the virus. If you look like measles, if you get vaccinated, you're not going to get measles again. If it's mumps, if it's chickenpox, if you're properly vaccinated, you will not get that virus back again. Now, when it comes to influenza, unfortunately, you may have short-term immunity to the initial problem, but it covers you for like a year. And then there's a new exposure that comes back. Unclear with COVID-19 if that is going to be the case or not. It may be a virus, kind of like influenza. Once we get a vaccine for it, every year we may need to get some version of the vaccine against it to help protect us from that insult.
That's always a rolling of the dice that you get it right.
That's correct. Depends upon the genetic background, correct.
That was my
Sorry,
last
I
question,
know, it
not.
was your last question.
Just mine,
Well,
just
and I
mine.
think this might be a good closing, but this board will be making some decisions in the next couple of weeks. We've already started to open up some departments for appointment. There's some folks who think we need to just open the doors and let the lines form at DVS. What's your advice for us as we go through the next couple of months? And again, it's just your advice. We get to decide, I guess. And how to protect our staff and still provide services. What's your advice on that?
That's a great question, Commissioner. My take on it is continue to do the screening and so on that we've already been utilizing in a lot of our departments. I think it is appropriate each time you would come in to check a temperature on the individual and question them about symptoms. It's appropriate also to have appropriate products available for good cleansing and so on, and hand washing and all of that. I think that's very appropriate. Social distancing until we figure something else out about this virus and have a vaccine is going to be appropriate as well. If you look at what's going on in some of our industries around us, you mentioned Amazon, Cambria, you know, I mean, they've got great screening tools in place. You know, I work over at Mystic Lake, you know, in their setting there. They've got some great screening tools in place there that they're utilizing to hopefully head off an exposure of this virus to people within that setting. And I would certainly recommend continuing to follow best practices of that type in the industries around us and just continue to follow those guidelines.
All right, not seeing any more questions. Thank you very much for that presentation. It's a big deal, and we do have to make decisions, and I don't think any of us is an epidemiologist or infectious disease. I don't. So we're clamoring for as much information, and we know it's changing to help us make informed decisions. So thank you for that report. I know you folks are always available, and thank you for that. And so now we're at item number 4, and I see Deb making her. Oh, is that a last question?
Oh.
Or wait, Commissioner Ulrich. Did I hear something from the speaker? Maybe not.
Motion to adjourn.
That's what I was gonna do.
Got it. We got a motion. We got a second to adjourn. Any discussion? Deb, take it away, please.
Commissioner Weckman-Brecky,
Aye.
Commissioner Wolf,
Aye.
Commissioner Beard,
Aye.
Commissioner Beer,
Aye.
Commissioner Ulrich.
Aye.
I don't hear him.
He's still napping.
but that was 4. So do you want to just, Commissioner Ulrich, can you hear us? I don't see him on the screen, but
We
otherwise
text
we
him
go with,
If he's still there.
We ran out of batteries.
he's muted. Well, we've
Left the
got 4.
Yeah.
You see him leaving the meeting?
Yeah, I think it's gonna.
With that, we've got enough votes to adjourn. We are adjourned. Thank you very much. All right, couple minutes, rock and roll. What's your pleasure?
Let's do that.
Couple minutes?
Yep.
Couple minutes. We will be back very quickly.
Then John can get back on. I bet he's trying to get back on.
Oh, Good morning. We are going to convene the Scott County Board of Commissioners June 2nd, 2020 meeting. Before we rise for our pledge, I've been contemplating, it's been a very significant week. It's been a very significant number of months. Still sort of debating, am I going to make comments? Or I certainly want to mention a man's name in honor of a life, George Floyd. I think we've all seen, heard, maybe have even been. But I think here's a man's life, and people might be saying, well, what does a guy in the suburbs know about a man in the city? But the few things that I've heard about this man are from his brother, that he was raised in a God-fearing home. From I think his sister, talked about he had baptized folks in Houston and was involved in ministries. So for me, a guy in the burbs with a guy in the city, we share a common faith. And so that makes us brothers. And some people may be offended by that, but the truth is we share a common faith, and that's bigger than anything. So I wanted to mention his name. Certainly feels like we live in a world in need of a savior from a pandemic, from all kinds of racial tensions, and a whole lot of other things. And it feels to me, this is by no means a political statement, but it sure feels like the political world has failed us, and this seems like a much bigger issue. So I guess I did make a few comments, but ultimately I would like to open this meeting with a prayer before we stand for the pledge. And I've mentioned this before, if prayer is your thing, join in, do your own prayer. If it's not, enjoy these next 8 seconds and for a little vacation. So if you'll indulge me. Lord, we're grateful for your presence. We thank you for your perfect love and your perfect peace, which is what you intended. But you also remind us in your word that we live in a world at war, that there is an enemy that is hell-bent on stealing and killing and destroying. But you have come that you may give us life and life to the full. And we claim that, Lord, today. We just ask for your mercy. We ask for your peace that surpasses all understanding, that can only come from you. Not temporal peace, not political posturing, but real change. And that we would welcome you back into the public square. We thank you, Lord, in Jesus' name. Amen. Thank you for indulging me. Let's rise for the pledge. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All words that this board means. All right, with that, got to regain my composure here. Number 2. Is there any amendments to the agenda? I haven't seen any, so the agenda looks like, or the agenda, I always like to kind of try to combine those to get through a little faster. The agenda will stand as distributed. Item 3, approve minutes for the May 19th, 2020 County Board meeting. We've had access to look at that. Are there any changes, deletions, or are we?
Mr. Chair, I'll move approval of those minutes.
Got a motion. We got a second by Commissioner Ulrich. Any discussion? Otherwise, I'm going to look to Deb for a roll call vote.
Commissioner Weckman-Brecky.
Aye.
Commissioner Wolf.
Aye.
Commissioner Beard.
Aye.
Commissioner Beer.
Aye.
Commissioner Ulrich.
All right, that has passed. And I should also mention, I always get to this point where we do the first vote and remember that Commissioner Ulrich, thank you for joining us via phone and protecting yourself and us. We are, again, socially distancing here in the boardroom. We have our masks to enter and exit the building. So we're trying to be smart while we learn more every day about this virus. All right, item number 4, recognition of interested citizens, always near and dear to my heart. I love giving people an opportunity to come and present anything they would like before the board. And I always look for my timer, but we'll see. You've gotten so good at, we got props. All right.
So as we get ready, I'd just like to know that I had served in the United States military.
Thank you for that.
I put 3 active, 3 inactive, honorably discharged, and I took an oath. And I actually meant my oath, and that I would follow through on it. So I've been talking to the board. I don't know if we can get the picture here going. So if you can start me on this timing or the presentation, if that's possible. I only have 4 slides, so I should do this one pretty good today.
Perfect. Thank you very much. So last meeting I was here, and I made 2 specific requests. And I said, hey, can you guys help me? So I want to actually show you what I got, because I still haven't gotten it. And you mentioned George Floyd, and we're talking, I think it's really an issue about the public servants and the public trusting their public servants. It's not a race issue. So black or white, I'm white, and I believe that I've not earned the trust of my public servants. So I made a request for a copy of the county's insurance policy. Here's what I got. 1, 2, 3 sheets. That's what I got. Now let me just compare and contrast that so you can kind of see the difference here. In 2013, I went to Gary Shelton, who was the county administrator at that time, and I said, can I get a copy of the county's liability policy? I don't know if you guys can see this, but here it is. And this is double-sided. This is the entire policy. That's what I asked for. My initial request just asked for the declarations, but I amended it right away, and I said, can I get it? So I don't know about you, but I'm not trusting I got what I requested. I got it in 2013. In fact, I got it right away. It's been over 2 months. I also asked for a copy of the notice that's required by law for Jolene Anand to suspend a person's driver's license. I was given an answer, I'm not even going to call it names, but I was given an answer, an email that said, we don't do a notice. It's our computer system. That's not the way the law is written about a computer system doing something. It requires 2 conditions precedent that need to be done to give a notice to John Harrington for him to do something. It's impossible to give 2 conditions because one of them doesn't even exist. Doesn't even exist. And I said, can I just have a copy of that? Because there's a failure there, so I don't trust the system. So I told you I was sentenced to 75 days in jail for a traffic ticket. 75 days for a traffic, and they called it criminal. There's no crime because there was no victim. There's no victim. There was nobody I stole from. There was nobody I harmed. But they called it a thing. And the state sentencing guidelines state $200 fine. Okay, so what happened? Judge Wilton ordered a pre-sentence investigation report from the probation office. Okay? A probation office that you guys fund. The probation office wrote this: Mr. Miser has a history of conditional release and probation violations. In addition, during the pendencies of these proceedings, Mr. Miser has continued to participate in criminal behaviors. Specifically, he has 2 pending driving after suspended charges in Scott County and Steele County. Therefore, jail time is recommended. State sentencing guidelines say $200. They said it is respectfully recommended that Mr. Miser serve 75 days in jail. How do you have that kind of an upward departure from the state sentencing guidelines when in fact Steele County dismissed it? They didn't even bother charging anymore. The third one, the judge said, hey, this is a $200 fine. We're reducing it to a petty misdemeanor. No jail time. Yet I got jail time, and it's from a group that you fund. You fund the probation office. You fund the county attorney's office. You fund child support. You have the power of the purse. So the last time when I was here, it was suggested that maybe you would investigate what you fund, that you might just do that. I would like to find out what, because I feel like George Floyd with a knee on the back of my neck and it hurts. I've not committed any crime. So I've talked to you what you fund. I have 3 specific requests. Can I get a copy of the insurance policy? I've only been asking for 12+ weeks. Can I find out? Can I see how did Jolene Adlan do what she did in non-compliance of Minnesota law? And would you guys be willing to investigate what you fund? You do have power with your taxing authorities for the taxpayers to ensure those taxpayer things are spent wisely and not to harm. And I have been harmed. Thank you very much for your time.
Thank you very much. Are there any other interested citizens? Just want to make sure we leave room for for anyone to come from the, not seeing anybody. So we will move on to item number 5, which is the consent agenda. And these are items that will pass in one motion that have been vetted by staff. So I will read through the list, and we'll start with 5.1. Approve the service agreement renewal with Prairie Care Medical Group LLC for psychiatric consultation. 5.2, approve acceptance of family group decision-making, or the FGDM, grant funds and contract with the Department of Human Services in the amount of $161,499 for FGDM services from July 1st, 2020 through June 30th, 2021. 5.3, approve the master agreement with Northwoods Consulting Partners, Inc. for implementation, subscription, and hosting of Traverse as an electronic document management and data analytics case management application for social service programs in the Health and Human Services Division. 5.4, adopt resolution number 2020-093, approving health, dental, life insurance, and flexible spending account providers and county contribution and employee costs for health, dental, and life insurance effective August 1st, 2020 for all eligible employees, and rescinding resolution number 2019-069. 5.5, adopt resolution number 2020-094, authorizing an amendment to a cooperative agreement with the City of Jordan for cost participation on the Trunk Highways 169 and 282 interchange preliminary design and environmental documentation. 5.6, adopt resolution number 2020-095, authorizing the Scott County engineer to request the Minnesota Department of Transportation state aid for local transportation to transfer $143,221 from the county's municipal state aid construction account to its regular state aid construction account. 5.7, approve the 6th Amendment to the Tower Land Lease Agreement with New Singular Wireless, doing business as AT&T Mobility Corporation, for equipment modification at the Jackson Tower site. 5.8, approve payroll processing of personnel actions. Those are the 8 items on consent. Are there any that you would like pulled for further discussion?
Mr. Chairman, I'll be happy to move the consent item as presented.
All right, we have a motion
Second.
and a second. Any discussion on consent agenda items as presented? Otherwise, I will look to Deb for a roll call vote, please.
Commissioner Weckman Brecky.
Aye.
Commissioner Wolf.
Aye.
Commissioner Beard.
Aye.
Commissioner Beard.
Aye.
Commissioner Ulrich.
All right, passed as presented. All right, moving quickly to number 6, committee reports and commissioner updates. I'm going to look to my right. Commissioner Weckman Brecky, please.
Thank you, Mr. Chair. On Thursday, May 21st, we had a MELSA board meeting. Just a little bit update on the counties, the metropolitan counties at our MELSA board meeting, and with our staff members, made some changes to the budget, putting more money into e-books for all the libraries, so that there's more availability for e-books, especially during this time when people aren't in the physical library as much. That evening, on Thursday, May 21st, had Scott County Library Board of Trustees meeting with our local representatives from each of our commissioner districts. Both of these meetings were held remotely. Thursday, May 28th was the steering committee meeting for Together We Can End Child Abuse in Scott County. Hearing about how we're kind of pivoting and figuring out how that committee is working and how the different activities are still happening towards that goal in light of social distancing. Friday, May 29th, participated in the AMC District 10 meeting, as I think many of you did. And then a couple interactions with residents during the last couple weeks. One was with a family member who has some parents at McKenna Crossing in Prior Lake, and we know, of course, there's some COVID positive staff members and residents there at McKenna Crossing. And this particular family member lives in Johnson County, Kansas, where the county has instituted the testing and is putting a lot of money into it, and she really wants us to do that and wanted me to bring that to the board. A difference that I told her with Johnson County, Kansas, is they are one of those counties that have more than 500,000 people and have received funding. I did talk about that, and I did have Lisa follow up with her about how, what we are doing with McKenna. And told her probably that's kind of what we're going to keep doing for now. But I did want to bring that up and make sure everybody knows of that interaction. And then just another issue, working with zoning and planning, Belle Plaine Township, on helping somebody get a garage permit. Had several conversations over the past couple of weeks about building inspections and wanted just some reassurances with some of our township partners that we are doing everything we can to keep building inspections moving, building permits moving. And I think from our reports that we've been getting every week, you see that they've actually been processing and issuing more building permits in the last 2 months than they did a year ago even. So that's good news. I think we need to make sure we're spreading that good news that even in light of working from home, of some things being harder, we're doing more. So important, I think, to bring that up and communicate that. That's the end of my report.
Thank you very much. I look down on my far left. Isn't that interesting?
Well, thank you for looking to the far left, Mr. Chairman.
Just directional. Just directional. Commissioner Beard.
Certainly. On the 26th of May, I did I think it was a Zoom meeting when the Intergovernmental Working Group with the new leadership team at Mystic Lake, and just had basically some updates. They updated their opening, which was happening that day, and how they were going to reopen the facility. Unfortunately, the restaurant is not part of that plan at the moment. I think it may be now, but yes, the rest of the gaming facilities and so on, they're slowly starting to unwind that and reopen. Excuse me, Mr. Chairman, I'm clearing my throat, not because I feel like I have the flu.
Allergy season. Allergy season.
Yeah, there's a lot of green dust in the air. It's pretty amazing how that affects me the older I get. On the 26th, I did attend that afternoon another Zoom meeting, the CAP Finance Committee, of which I serve, starting to look at their budget for the next year. The CAP agency's in pretty good shape, but it really is confusing, and that's an important statement to make because of the new software that we're buying, a new finance package for Molly, the new CFO. CAP agency deals with private institutions, private foundations, which usually deal on a January 1st to December 31st basis. They also deal with the state of Minnesota, which deals on a July 1st to June 30th basis. And they also deal with the federal government, primarily with the federal government, which of course, for reasons known only to people in Washington, I guess, goes from October 1st to September 30th. So it's a mishmash of starting and ending dates and trying to keep track of how much of a grant is still available and how much has been spent, with 3 different starting and stopping dates is pretty confusing, but this new software apparently is going to help straighten that out, which should make the financials a lot easier for all of us to follow along with. On the 27th, I actually had an in-person meeting with the County Administrator, Leslie. Thank you for making your office available for that. I'm getting a little tired of looking at computer screens, and I do appreciate the personal in-person discussions. And on the 29th, we had another AMC District 10 meeting. I noticed a couple of my colleagues were also on that with me as we kind of came up to speed on what was happening, not only with the whole flu pandemic thing, but by that time, of course, the whole tragedy had unfolded with everything that was happening in Minneapolis. But more importantly, it was unknown at the time, but the professional rioters had come on the scene and were causing untold damage and mayhem and carnage. It was awful, and we're kind of reacting to that until it was becoming clear what was happening to us. So that was quite an impactful meeting on Friday, the 29th. And this morning, with many of you, had the privilege of touring the new building and kind of getting a progress update. Mr. Chairman, that's my report.
Thank you very much. Let's move to Commissioner Ulrich, please.
Okay. On the 20th, I had several meetings. All my meetings were Zoom or technology meetings of one form or another. Greater MSP Business Investment Committee, later that same morning, Greater MSP County Commissioners meeting, and then the Transportation Advisory Board later that day. The 26th, the Chair, Vice Chair, And then the Fish Outreach Partner Relations Committee met later that day, and we're trying to figure out how to work with our partners and encourage our partners in kind of a Zoom world, and how to communicate and work together. The 27th, my monthly meeting with the Savage folks, and the June 1st Greater MSP board meeting. We're going to have a number of board meetings from Greater MSP because we're really looking at what has happened to us with the George Floyd death and the brutality and the racism that was evident there. This event has really created a tremendous negative for our region, for Greater MSP, and so we're going to be discussing the brutality and racism. We're going to be discussing, I'm guessing, the law enforcement. Well, this is my opinion. They haven't said this, but I think there's three things we need to discuss. One was I mentioned already, and then the law enforcement and its response to the rioting and looting. Was that appropriate? Was that adequate? I would say dramatically not. I couldn't believe it. It couldn't have been more mishandled, in my opinion. And then the devastation to business that's occurred. Hundreds of businesses devastated, destroyed, looted, burned out. That's not a positive for our region. We have to correct all these things. I think task one is to figure out how a police department can get rid of bad apples. They've known certain bad actors have existed within a police department. We have to figure out a way that they can be gotten rid of. And so a lot of these things will be touched on by the board. MSP board, some of them are just my opinion, and but it's a very troubling on multiple levels what's happened to us. So that's the end of my report.
Thank you very much, Commissioner Wolf.
Thank you, Mr. Chair. In addition, I'm going to echo what Commissioner Weckman-Brecky said about lots of constituent calls, lots of meeting up with those, lots of people concerned about what's going on out there. And on the 20th of May, the insurance committee met. Discussed a few things. I think our balances are actually doing well, and it's not because of everything that we've done great. It's more because people can't get to the doctor as much these days because of the whole deal. So we're not, the dollars aren't being spent. On the 27th, the Metropolitan Mosquito Control met. On the 28th, the Vermilion River Joint Power. Also that day met with the Market Township Chair about constituent and a water problem that somebody dammed up a spot over there in a neighbor and has flooded an area of someone else's land, and so that's we got to try to resolve that. That evening was Skype meeting with the Elko New Market City. On the 29th, Senator Pratt, we have some issues. We just talked about mostly the McMahon Lake and the bonding and that bill and how that's going in the Senate or the State House there. He doesn't know how things are going to shake out there, and I don't think a lot of people do. On the 1st, met with the Spring Lake Township supervisor about the motorcycle thing out there. Some people have put a little motorcycle track in, and a lot of the neighbors are not happy about that. So, and yeah, I laugh, but it's serious. But then that night, Credit River Township had their meeting. Prior Lake City had a workshop and a regular meeting. In the workshop, they decided they're going to do the fireworks show on the 4th of July.
For them.
So I think that's a great thing. Cedar Lake also met that night, and as of right now, this is not a Cedar Lake Township thing, but their church festival is still on. And then this morning, the board tour. So there's my report.
Thank you very much. It seems like it's been about a year since we last met with all the things that have going on. But in between last meeting and this meeting, I just wanted to point out, well, I was getting my parents settled back into their home Memorial weekend, and it was an unbelievable Memorial weekend. I was not in Prior Lake, but there was a walk, which maybe, it's happened all over different communities, but all of the things were canceled, right? But folks in the VFW said, no, this one's not. We're walking in the rain. Join us if you want. And it was unbelievable. probably better than any organized event I've seen. And so we didn't have great cell or internet or other things to do with TV, so I really didn't see the events until a few days later. So that kept the Memorial Weekend very peaceful. Came back, we had the chair, vice chair on the 26th, fish meeting on the 26th, I believe IWG, my dates might be a little off because it's a little wonky these last couple weeks. IWG, was a good meeting to keep in communication with them. 29th, the AMC District 10 meeting, and then someplace in between those dates of last week and this week, countless phone calls, and looking at Leslie, and I'd look at Luke if he was in here. There were some questions that I was asking of our public safety, and I had to, like, this is gonna sound bizarre, like I can't even believe I'm gonna say this, but like, are we thinking about this and that? And I know we have, professionals in there, so thank you for your patience with all those interactions, but I needed to know that we were, and I know we did, I know we were looking at it, but I just needed to know for public safety and what if, and you really got to think a lot of what ifs, and it sounds very bizarre because you don't know. So thank you for your patience and dealing with me for those 3-4 days. And I had great conversations with many of the mayors, many of the chiefs, or their staff, just to make sure that, like, was there anything we needed to do as a county that wasn't already being done? So thank you, everyone, with their willingness to pick up the phone and be collaborative. And then the tour, as mentioned this morning. So with that will complete my report. So I will look to Leslie for our county.
Can I just
Yep,
make one
absolutely,
comment?
yes.
Our sheriff's department, we were getting lots of emails and calls and stuff, but they were prepared and ready for it. They were here a lot, and I mean, I was seeing text 3 in the morning pop in. It was like, yeah, so they went above and beyond. So just wanted to put it in plug.
Big time, big time.
Yep.
Mr.
Yeah,
Chairman,
I clarify my comments on law enforcement. It wasn't Scott County's law enforcement. I'm talking about Minneapolis.
Yes,
Right,
yeah.
right.
We all knew, but good clarification. Yep, for sure, for sure.
Mr. Chairman, Commissioners, yes, I think of as Friday, Luke and Ron and I and the Vice Chair and the Chairman eventually also were on the phone discussing a curfew and the
right.
need. All of the vehicles were removed that were outside down where they were enclosed at the central shop. Luke was giving us constant updates, and we heard from him every night about 1:15, 1:30. They had been in planning, responding. We did help support Bloomington, I believe it was, in some protections of their areas or the requests that came in. So yeah, I think they were on top of it. Ron was there with Scott taking a look at a curfew, but we never felt it got to the point or that there was a threat there that we needed to do it and shut everybody down in our community. Through some of the COVID, if they had seen groups congregating of over 10, they could have taken some actions under the peacetime emergency if they had determined they needed to do it. So I think they have been engaged. They've been engaged regionally, and they've been engaged locally, talking to Chief Frazier, talking to Chief Tate, those folks as well, to make sure that if they needed something or wanted it requested, it would get brought forward to take a look at. So I think they were very well prepared for it. And I really appreciate the way Luke and Ron, this is the second meeting in a row I've been up here, the way all of our different offices work together to coordinate and make sure that we're prepared. I really appreciate that. Last week we did have the library open up there by appointments for computers, and they have had people now checking in and getting access to those computers. It appears to be working well. And today I was advised the Workforce Center opened up for access by appointment as well for folks for economic assistance and opportunities for resumes and jobs and those types of things. So slowly but surely, I know Commissioner Brecky asked in the earlier meeting, we are opening things up by appointment and allowing folks access to the things that they need to have that we support. So with that, that's what I have today.
One thing on that, and this is not a, because I don't care about credit and bragging rights, but I think it's important for some people to know that we did try to open some things ahead of, I don't want to say the curve because that's so out of context, but just to try to get things moving, but that created some backlog because there was so much demand. That's the only reason I want to bring it up, is that we're trying to get things open in an orderly way.
There's definitely a backlog, I think, out at the household hazardous waste. There probably is in driver's license, even though I was saying to Commissioner Brecky early, they really like the appointment because they can come, they can do their business, it's 15 minutes or 20 minutes, and they're gone. So there's a lot we gotta figure out what the balance is.
Right.
For some of those other type things, like title transfers, and those issues. But yeah, Pam and her group were actually working to open up the workforce center ahead of the state. And since they don't operate our
Right,
career
right.
force center, we made the determination to open it up. That was your direction, I think, several weeks ago. Let's start, if we can safely do it.
Yep.
Take care of our staff, take care of our clients, create that social distancing and what we need to start getting these things moving. The other one that they are working on that we're going to approve here is to help with some of our day treatment youth who typically would
Oh,
be
yeah.
over in Shakopee and have some education contact as well as treatment contact. But I think Dr. Raditz, who has been so supportive, and Barb and Pam through this and have gone to telemedicine, when they're telling us that there are 9 to 12 kids who really, we need to get this moving, I trust them, and we are doing everything we can to move that one forward as well. Probably a little bit ahead of what some other people are doing. So we are trying to open these things as we see the demand and the need.
Yeah, we don't want any more statistics in some other column if we don't do things, so nice work on that.
Thank you.
Thank you. Looking to my right, Mr. County Attorney.
Thank you, Mr. Chair. Before I answer your question, I'm going to just briefly say that as the person who dealt with Mr. Miser the most, I found his comments on Mr. Floyd very disrespectful and insulting to Mr. Floyd's memory. And I'll also say that I will look into exactly what he was provided and make sure he gets provided the information that he does want as a continuing operation. He already has the 2013 one, so those things typically don't change a whole lot from year to year, but I'll look into getting him what he wants.
Please.
And I will also, I've also explained to the board previously in an email, I believe, exactly why and what happened with all of those DARs, so I'm not gonna go into that with you again. That's in a previous email.
Yep.
I just wanted to say that I found his comments completely inappropriate.
Agreed.
With that, Mr. Chair, we do not need to meet.
Well, and with that, in that particular interested citizen, we had comments last meeting. And you've made your comments, and thank you for that email, because I remember getting that email. There's always more to the story, and this board wants to do well by everybody, and so there's always more to the story. So, yes, sir.
Mr. Chairman, two things for the county attorney, if I may. And I'm sorry, I should have given you a heads up on the second one beforehand, but we're friends. I can catch you a little flat-footed if you need to.
There's the kiss of death right
The first
there,
one,
right?
though, regarding the driving after revocation deal, you provided that to us. But may I ask that you put that in the minutes for the public to see? Because he's making public allegations against our staff and against the judiciary branch that I think there is an explanation that, because the average person goes, what? How does that work? And my initial reaction, of course, is the same, regardless of my past relationships, whatever, with the gentleman. Still, fair is fair, justice is justice, and what the heck? And I know you explained it to us in an email, but again, I'm over 65 now, and I couldn't even find the stupid email if I had to. Would you just encapsulate again, and we can put it in the minutes? That'd be my request to the board. He's made a public charge. I think it should be a public response.
And just so I'll clarify also, what I will say on the record here is public information for anyone who would want to look it up.
Yeah.
His first driving offense without a license here occurred in Scott County. This is after our court system has dealt with Mr. Miser also for years on other non-criminal but civil matters of various forms. So there's a long history of Mr. Miser dealing with our judges in the district court here, not only on these matters what I'm going to talk about. So they're very familiar with Mr. Miser. So the first driving after was handled by my office, obviously, and it went to district court with Judge Wilton. He ordered a pre-sentence investigation, as Mr. Miser indicated, and that came back with the recommendations from our probation agency, again, who also have a history with Mr. Miser. They made their recommendations. The district court judge, Judge Wilton, again, who has a long history with Mr. Miser, followed those recommendations. The Steele County ticket, they chose, after seeing what the district court here in Scott County did, they made the decision for whatever rationale they did. I can say that if it was, I have made similar decisions from my office, seeing what another county did with a similar charge. I made a decision for various reasons, one being our resources, whether you have to transport an individual, there's various reasons why we do things. So Steele County made the decision, after seeing what Judge Wilton did with the case here, to dismiss their ticket. Again, I can't speak to exactly their rationale, but it's just my guess. The third ticket, again from my office, is a misdemeanor ticket. Misdemeanors have a right to a jury trial. I made the decision to certify it as a petty. The court didn't make the decision, they can't do that over my objection. Community Services didn't make that recommendation. My office certified it as a petty to take it out of the jury system, because I didn't want to spend my office's resources and the county's resources in bringing a jury for this offense. So we made the decision to certify it as a petty, and we had a trial on the petty misdemeanor. And that was actually to his benefit, because the conditions and the punishment are completely less, or severely less, for a misdemeanor than a petty misdemeanor, for a petty misdemeanor than a misdemeanor. So that is the decision I made, and that is why.
To be clear, most driving offenses are civil offenses, not criminal offenses, except for like vehicular assault, or DUIs are always a criminal offense,
Correct.
Things like that. But most speeding tickets, parking tickets, driving after revocation aren't criminal offenses, except in some cases when there's repeated behavior, and at some point, what did you say, third?
Driving after suspensions are elevated more than just a speeding ticket.
Okay.
Because there's reasons your license has been suspended.
Yeah.
That happened before that result in the suspension, so that's why it's elevated to a criminal matter at that time.
At that point, okay, thank you for the clarification. I do have one other question that's gonna, but it's related to the whole chaos and destruction and fear that has just swept through our city, our state, and the entire nation, actually, over the last week or so. It's become apparent that that someone somewhere is highly organized, in that there were over 40 cities hit with almost exactly the same MO of random fires, of weapons and resources being staged around town, so that, strangely enough, there were bricks to throw where there hadn't been any bricks before. Things like that. Stuff is going on. And I had a couple of neighbors stop and ask me if this roving band came through our town. Now, they probably wouldn't come down my street because it's so far apart, and it would be a wasted effort if you're looking for maximum damage. But nonetheless, what if? What if my proximity alarm went off and somebody's firebombing my little outbuilding there? Am I permitted to get the shotgun out and start shooting? Neighbors down the street that have the meat market down the hill at Southbridge said, can I defend my property there with lethal force? And these are serious questions that rational people are asking, rather than just stand by and helplessly watch our men in blue or brown or whoever, green, that are called in to defend us. I think at the very core of our being as Americans, we look at the first line of defense is us. It's us. When we're overwhelmed and when the law needs to be put into play, we have a whole system set up there to prosecute criminal behavior. But when and clearly in Minnesota law, if somebody is inside my house wreaking havoc or threatening, lethal force is authorized. A prosecutor is going to bring charges against anybody like that. But what if I'm at my gas station and somebody is trying to torch my place or tear it up? Is lethal force allowed there? Or what kind of force can be brought to bear against people who would deliberately mean harm? Can we create a roadblock and keep vehicles with no license plates, for instance, out of our neighborhood? How far can we go to make that happen? These questions are being asked, and I think that we, I think in America, we've crossed a divide here to where we have people who deliberately mean to destroy the open society we have. And they're moving in the shadows, and we don't see them until what we've come to know as a black swan event happens. A rogue police officer does something really dastardly, like we witnessed last week. That's a kind of a trigger that I think highly organized people are taking advantage of all across the country. We've seen that this last week. Over 40 cities with the same MO, the same people in black breaking windows, military-grade incendiary devices being found in every city in the nation. This is bizarre. This isn't just some kid throwing a match into a dumpster and starting a fire. There's something going on here. What can we as citizens do? What can our sheriff do? Because I know in some western states, they'll deputize people to help when there's a situation. I know we have reserve corps for helping with like the Renaissance Festival or the state county fair, things like that. I'm kind of rambling here with the expectation, Ron, but at some point, could you give us maybe a little primer, or maybe we need to go talk to our legislators about what it means to be an American and defend yourself and your property before the sheriff gets there, before the police get there, or before the National Guard is called? That would be very helpful.
I hesitate to give you,
Yeah, and you may not want to go very far right now. Yeah.
the black letter of the law is that you can defend your life or the life of another.
Yeah.
Everything else is situational, and again, I'm not going to give county-wide legal advice on what you can or cannot do
Thank you.
in a given situation. I think the sheriff's office always has the option to deputize anyone if Sheriff Hennon feels the need to do that. That's certainly within his prerogative. But everything else, extremely situational, and it would case-by-case basis.
I've got a scolding look
We've
over.
been asking and
Well,
Lindsay
that's
said no.
that's exactly. Where's Luke?
Yeah.
Because I don't know, by text I said, Luke, hey, if you need somebody, I'm willing to be deputized. And maybe I was talking to him because he laughed. I'm like, wait a minute, what is that? I'm taking that as a no, a laughter.
You know, we all joke about Elvis Presley being deputized and carrying and I'm not talking about that. I'm talking about the 4 or 5 days out of every individual's lifetime when something really bizarre happens, like has just happened. My fear is we're not going to have to wait another lifetime to see it
Oh,
again.
no.
Another 3 or 4 years, this could happen again. Now, I do know some things that are going on at the federal level with electronic intercepts and things like that. They're actually starting to zero in on a couple of these shadowy organizations which really have no leader as much as they have an ideology, and that is that America's evil and has to be brought to its knees. I don't know what we do with that, and again, you're wise in not telling us yet. You can shoot that person, but I don't want to know that. But at some point, we should make it clear to our citizens, like that sheriff in Florida did, when he said, well, you're riding here in the city now, but you may want to think twice about going to the suburbs because they have guns and they shoot.
Right.
I mean, that's just a comment. that was made.
Minnesota is a big gun-owning state.
People know how to shoot better than I do out there, so.
Well,
But we are not encouraging.
no. But that's the reality. We are in this bizarre window of that is not a bizarre question right now.
Right.
It's unfortunate that it's not a bizarre question.
Right.
Yeah.
Right. I found myself asking a lot of, different but similar, but I'm like, am I going to let this out of my mouth? Because I just needed to know. But yeah, there was a level of command and control exhibited in some of those groups where I'm like, whoa.
Yeah.
That changes the game. But again, another topic we could talk about for hours, but we will be digging into it. And
I just wanted to add a positive note.
Nice.
I forgot off my list.
Thank you.
I want to thank Jamie and Building Inspections and Marty and Brad and Greg for the work they've been doing with the rural restaurants. So with basically a napkin sketch and administrative approval, they've been working to get them outside. We've waived any of the permit fees since this is a really highly unusual situation. You know, we have 11 or 12 of them in our rural areas altogether, but they have been working. Some requests have come in to move those and get them through very quickly. And I had that on my list and I forgot to mention it.
No, that's good.
Yeah, that's another thing we've had calls on,
Yeah, and I'm going to dovetail on that. I went to church, the real building, for the first time on Sunday, and they had it socially distanced, very well oiled, separate. And I tried to go to a restaurant last night, but I had a meeting and kept me late. But they looked like they were all very distanced and outside, of course, and plus it was a nice night, and I got shut
Me
down on that.
and my family went to Lakers Tavern in Prior Lake and sat outside. It was really nice.
Which is, it's a nice option to have. You don't have to go, but you can if you want. So that's what's awesome.
Mr. Chair, we do not need to meet.
Thank you. There we go, because I saw Deb making the move. Yeah, there's that part too. He's just following the positivity. I love it. That's awesome. Thank you for that. All right, so we are on number 9, adjournment.
Motion to adjourn.
We've got a motion.
Second.
Oh, I thought this was going so good. I thought maybe.
Commissioner Ulrich got it.
All right, we'll give him that second. Any discussion? Well, that could be a loaded question. Otherwise, Deb, take it away, please.
Commissioner Weckman-Brecky.
Aye.
Commissioner Wolf.
Aye.
Commissioner Beard.
Aye.
Commissioner Beer.
Aye.
Commissioner Ulrich.
Aye.
Before I gavel us out, I should mention that we were at a tour of the building at 8:15, and we had a community health board meeting at about 9:15 or so. And after this meeting, we are going to go into a workshop setting regarding the budget. So with that, we're adjourned. Thank you very much.